The Program Integrity Alliance suggests that there's a better way to reduce fraud than the government's current pay and chase approach. But to make it work, someone will have to change the rules and approve new investments. Whose job might that be? Boston University assistant professor and PIA senior fellow Jetson Leader-Louise has some ideas. Jetson, thanks so much for joining me today.
Thanks for having me.
You know, we've all heard the stories about major fraud in government programs, from Medicare and Medicaid and unemployment insurance to pandemic support programs like the Paycheck Protection Program. How does the government use a process called pay and chase to recover those fraudulent payments?
So the dominant strategy that the government uses right now to try to identify and stop fraud, the really pervasive way that they do this, is by allowing law enforcement to go after those who commit fraud. So the government has a number of law enforcement arms. We have the Federal Bureau of Investigation, who does criminal investigations. We have the Department of Justice. We also have agents with groups such as the Health and Human Services Office of the Inspector General, or other members of the Inspector General community and other public programs. And generally, fraud happens, and then there's a chasing portion. We've paid out the money already, and then there are criminal and civil lawsuits against these folks. A lot of that occurs under the purview of the False Claims Act, which is a federal law that allows whistleblowers to use court-based enforcement to recover funds with damages from folks who overbill the federal government. And so when we say pay and chase, we're talking about this broad system of allowing these fraudulent claims to be paid and then trying to use law enforcement to catch them after the fact.
But the government doesn't have enough people to chase all the fraudsters. And even if they caught them, some of those fraudsters can't pay their bill, right?
That's right. And so when we look at what I'd call diffuse frauds that are done by many different people, this strategy really starts to break down. And a great example of this is with the Paycheck Protection Program. During COVID, we saw hundreds of billions of dollars paid out through the Paycheck Protection Program, but largely in small amounts to very different people. And so once fraud became prevalent in the Paycheck Protection Program, which it was, it becomes impossible for the pay and chase paradigm to succeed, because the federal government cannot run federal criminal lawsuits against thousands of different fraudsters. And so what's happened is that strategy failed to have a meaningful effect either on stopping the fraud in the first place, and now we're seeing very limited effects of money coming back in from these lawsuits.
But you're now advocating for a prevention approach, an upfront way of stopping fraud before it happens that's going to work better than pay and chase, or at least have more of a possibility of preventing the fraud. Give me a couple of examples of how that would work.
That's right. So an alternative to pay and chase is to put in more preventative measures, more controls on money to make sure that legitimate recipients are being given money for legitimate goods and services that they provide for the U.S. government. A great example comes out of Medicare. In a recent study, we looked at fraud in the ambulance sector, where there was substantial fraud in the transportation of dialysis patients to and from their facilities and their homes. Between 2003 and 2017, Medicare spent $7.7 billion on 37.5 million ambulance rides given by over 3,000 companies. And as this fraud became more visible to the government, they increasingly ran these lawsuits. And so we see almost 70 lawsuits, both criminal and civil, against ambulance companies that tried to get them to stop committing this fraud. The issue is you're suing 70 companies, but there are thousands of companies providing these services. And so the litigation approach, the pay and chase approach, was pretty ineffective. And then finally, Medicare says, okay, enough is enough. Let's try to stop the money from going out the door. And they implemented something called prior authorization. And prior authorization just says, we're not going to pay the money until we have the documentation in place to say that this patient actually needs an ambulance, which in the case of these dialysis patients means that they have to be basically bedridden. And so if you cannot get documentation showing that this is medically necessary, we're not paying it out. And so our study looked at the effects. We found that following the rollout of prior authorization, there was a nearly 65% decrease in spending on these ambulance services immediately, persistently, and it was really well targeted. We see no evidence of increased hospitalizations or mortality among the patients. Really, it was just a pure win in terms of savings.
So that's a fascinating example, and it's great to hear about the positive outcome from it. But it seems to me that the approach that you're arguing for kind of runs into two real-life problems, right? First, our existing budget mechanism doesn't count cost avoidance. So it counts cost savings, but the investment to avoid cost is difficult to quantify. That makes it hard for people to justify the investment. And the second is we don't really have the data yet to estimate the value of fraud prevention, which would be important in justifying the upfront investment, whether it's technical or regulatory. So how do agencies who want to take this fraud prevention approach overcome those obstacles?
This is a great point. So first, I want to say that the prevention has an incredibly high return on investment. Another example is the use of ID.me in the unemployment insurance system. Through COVID, we saw hundreds of billions of dollars of unemployment insurance outlays on top of the normal, both through the expansion of regular UI as well as through the PUA, Pandemic Unemployment Assistance programs. And there was substantial fraud there. Nobody knows exactly how much, but between 10 and $100 billion of fraud was lost. This was all administered by the states. And when the states rolled out ID.me, we saw a big decline in fraud. I have a recent study on that as well that shows that ID.me caused about a 20% decline in suspicious, maybe 30% decline in suspicious activity. Where you look at cards that were taking out large amounts of cash after receiving their unemployment insurance. Great. How much does it cost to do ID.me? It's actually not that expensive, right? And so I agree that we need to be sensitive to these, budgetary concerns, but some of the wins that we're talking about are actually not that expensive and technologically feasible. The fact that everyone now has a smartphone, the fact that we now have the ability to use more sophisticated data and AI systems means that we can be doing a lot better job with technology. But you do bring up the budget rules. So as we all know, the federal government doesn't budget these preventative measures. It has to do with the Congressional Budget Office scoring rules and general accounting standards. But I argue in some recent work and white papers that these estimates can be made consistently. We have a good understanding of how much money these efforts save. And even though you do have to do a range of estimation, you might say it's between this number and this number, that can give you a decent return on investment estimate. And so we should be thinking about this as like an infrastructure problem, right? When we go and we build roads and trains and ships for our military, we understand that there is sometimes hard to quantify, but there is a return on investment on those things. And so that approach needs to be taken when we think about increasing the government's technological capacity for preventing fraud as well.
I'm speaking with Jetson Leader-Luis. He is an assistant professor at Boston University's Questrom School of Business and a senior fellow with the Program Integrity Alliance. So let's talk about making it harder or easier for claimants. One of the reasons that the government chooses the pay first approach is to make it more responsive to legitimate claims. You've argued that these new technologies can minimize the hassle costs of pre-validating claims. So how does that actually work?
I think that we have to think about it as a dial, and we're all the way at 0. And I'm not telling us to turn it up to 100, but I say that there's a reasonable middle ground. In publicly available data that you can find on the own government's website, you can find doctors who are billing just absolutely ridiculous amounts of services. Doctors who bill for a service that it takes 60 minutes to do and they're billing 4,000 of them a year, and they're not working 4,000 hours a year. And so even just implementing systems that have the ability to shut down some of the most egregious channels, that type of prevention, I think, can be done without harming patients or without harming legitimate beneficiaries because it can be targeted towards the most obvious and egregious frauds. With the Paycheck Protection Program, something like 20% of the money went to businesses that didn't exist before the pandemic. They're not in any records before the pandemic. And so I think it's absolutely important that we continue to have programs like the PPP during crises or unemployment insurance. I'm not saying that every single recipient needs to go through the rigmarole in order to qualify for this, but we're all the way at the other end of this. And so I don't think that that's the best argument because we should take the first step and the second step and the third step. And at some point, if we want to ask the question, do our feet hurt from walking too much? We'll get there when we get there, but we haven't even started.
So when we think about both the challenge of implementing these measures up front and the rules that we just talked about, whose job is it to change the rules and change the metrics? Because we all know the phrase, what gets measured is what gets done. We're measuring those things because that's where the incentives are. Who changes it?
That's right. So I think a big problem here is that it is common in the anti-fraud community to count recovery dollars and not count prevention dollars. So if we have $100 million of fraud, we go after people, we get $20 million back. Everyone celebrates. So look at this big $20 million check that got rid of the government. Wow, this is wonderful. But if we prevent the $20 million from going out the door, the $100 million from going out the door, silence. And so we see some amazing examples. The Center for Program Integrity within the Centers for Medicare and Medicaid Services had $4.2 billion of prevention of catheter fraud. It got a one-page PDF on their website that nobody ever talks about. If that $4.2 billion was a lawsuit settlement, they would trot out the attorney general, and this would be a big cause celeb for how effective it is. And you're right. And the reason is that these prevention dollars are not being counted as real dollars. Where does this come from? With whom does the responsibility lie? I think a few. The first is within the IG community across government, I think there needs to be an understanding that prevention and those dollars are real dollars. Money that the government does not spend should be counted on the return on investment. It should go into the reports to Congress because those monies not spent are real. If we did not do that good work of, that the IG community does, and they do great work, those dollars should be walking out the door. And so I actually think about this as a justification for, the expansion of our program integrity colleagues because they're providing so much value. They're providing more value than they even count. So I think part of it has to come from within the IG community to coalesce around this idea that the prevention dollars count. But a lot of it also lies within the leadership at the department level. The secretaries in the departments that administer public programs like Treasury or HHS or HUD need to send down the line this idea that we're not going to just do pay and chase. We're not just going to let the dollars walk out the door. We're going to be proactive in ensuring the public integrity of the funds that we spend.
Well, certainly the DOGE teams in all of the agencies have been highly focused on the detection and elimination of fraud. Are your recommendations getting any traction with them?
My understanding is that DOGE, particularly when it comes to healthcare, which is where I specialize, are interested in implementing better controls and to reform the existing system. When Medicare claims are processed, they already go through a program integrity contractor or a series of program integrity contractors, depending on which region of the country the claim is coming from. And my understanding is those program integrity contractors are not effective. And part of it is that they don't really have incentives to be. And so I think I'm very positive on DOGE's opportunity to improve the Medicare and Medicaid programs because the systems are already in place to try to stop fraud. They're just not operating correct. And I think that if we think about the legacy of the U.S. digital service, which is really where DOGE comes from, that those are exactly the sort of technologically capable folks that are able to debug these sort of technical systems.
I guess the proof will be in the pudding.
Yes, it will.
Jetson Leader-Luis, assistant professor at Boston University's Questrom School of Business and senior fellow with the Program Integrity Alliance. Thanks so much for joining me today.
Thanks, Terry.
We'll post this interview along with a link to his report on federalnewsnetwork.com/Federal Drive. Hear the Federal Drive wherever you get your podcasts.